Okay, so I think that's a good point to kind of talk about aging and bone and what changes happen as we age. Um, I mean, at a high level, could you just talk about? I mean, osteoporosis. I believe it happens as you get older. It's a thing of age. So could you just talk about in general how bones change over a lifetime?
Sure, and this varies a little bit depending on whether you're a man or a woman. So
Right.
once again, men come out better than women on this. Unfortunately, we're
Okay.
very lucky. We're very lucky.
We're lucky. We're lucky. Yeah.
There are really two kinds of, or there bone loss. There are two kinds of bone loss, really. One is related to hormone changes, particularly in women, but to some extent men. And the other is simply related to the fact that our bodies are aging. So in women, when women become premenopausal and then menopausal and postmenopausal, they lose estrogen. And estrogen is a stimulus that prevents bone loss. So when they no longer have the estrogen stimulus, they begin to lose bone. And this is why estrogen as a therapeutic treatment was used and still is used in some cases, although less frequently, because it will prevent that loss. Won't prevent that loss, but it'll certainly slow that loss. Then, in addition to that, as we all get older, we lose bone because the cells that we have in our body, there are fewer basic stem cells in our body, which will go to form osteoblasts, which are the bone forming cells. And so consequently, we may have less bone formation as we get older, and this can cause bone loss too, because formation is not really keeping up with the amount of resorption we have. In addition, and this is less widely recognized, I think, as a cause of bone loss, but well, I'm sorry. I was going to go on to something else. I won't go on to that.
Oh, okay.
So anyway, the reasons are in women. There's a loss of estrogen, which prevents
Yeah.
bone loss, and then in all of us, as we age, the cells age too. So we have smaller populations of cells, and they are not really quite as vigorous as they were when we were younger.
Right. So I'd like to think about, you talk about bone constantly remodeling, right? The resorption and that process. So does that change as you get older? I mean, does it become less effective?
It does change. Effective is a tricky word, but it does change. And what will happen is typically as you get older, bone resorption will occur more, and bone formation will be suppressed. So that you have, instead of these two things being in balance, you have now an imbalance in favor of resorption and in favor of bone loss. And that basically happens in all of us.
Right. I mean, is there anything we can do to change that? Yeah.
Well, there are some things to do. Without, I mean, of course, there are a number of pharmaceutical agents that can change either resorption or some now that can actually change the formation. We can talk about those if you want to, but
yeah,
outside of go ahead.
So let's get to that bit, because actually I'd like to talk about diet and that, and probably supplements would come in at that point. Yeah. So one thing is, so as you age, another thing as you age is that you do that there are some chronic diseases that happen, like diabetes is one of them, I think, which may impact health, which may impact bone health as well. So do any of these chronic diseases impact bone health, and in what way?
Well, diabetes certainly does, but diabetes is not really a disease of aging. I mean, young people can get diabetes and older people can get it or not get it. I mean, the reasons that you get diabetes typically are not because you're getting older. They are either because you have a genetic issue in type 1 diabetes, or because you're not eating right, not exercising right, and you get overweight, and that can cause type 2 diabetes. So there are two types of diabetes. One is type 1, one is type 2, depending on whether you're, not secreting insulin, or whether you're secreting insulin, but your pancreas is not really dealing with it very well. So there are two types. But yes, in diabetes is a disease, a condition in which several things can happen. In type 1 diabetes, there is a loss of bone, so it tends to have low bone density. In type 2 diabetes, there is some increased porosity in some areas, but typically bone mineral density measured by these bone density tests that we've been talking about is normal, or in some cases it's even greater than normal. So the two types of diabetes are very different. What's similar and what makes the bones more fragile in diabetes is that high levels of sugar, which occur in both type 1 and type 2 diabetes, because the insulin is not, filtering that out, for want of a better word. High levels of sugar will cause collagen to cross-link in certain ways that cause it to become brittle. And so we mentioned that collagen is normally ductile, but when there are high levels of sugar, this causes a biochemical reaction that causes the development of something called advanced glycation end products, which are not really collagen cross-links, but they do bind the collagen fibers together, make them less ductile, make them less able to bend and slide and do the things that they would normally do to make the bone more ductile. And so when you bind the collagen fibers that way, it tends to make the bone brittle. And this is what you find in diabetes. Even with type 2 diabetes, people with type 2 diabetes are more likely to fracture their bones, even though they have normal or even greater than normal bone density. And the reason is because their bone has become more brittle because of the formation of these AGEs, these advanced glycation end products, that cause changes to the function of the collagen.
Interesting. So, so before diabetes, you have like pre-diabetes. So is any kind of elevation of blood sugar going to have some effect on this line in this kind of direction?
Yes, it will, because pre-diabetes in pre-diabetes, you also have higher levels of sugar, so they may not be as high as when you become fully diabetic. But any increase in sugars will cause those AGEs to form. And so, yes, pre-diabetes also is a risk factor for that.
Right. Okay, so I get somewhat related, but maybe not. So is there an optimal BMI for health? Does having extra kind of fat percentage, is that negative for bone health?
Well, it is if it causes you to become diabetic.
Okay.
So the optimum BMIs really are below 25. So of course, BMI is your height in kilograms divided by your weight in kilograms divided by your height in meters squared is how you calculate it. But if it's less than 25, that's good. If it's between 25 and 30, can be characterized as overweight. And if it's over 30, you can be characterized as obese. Now, that's not a perfect measure. I have a good friend who is a wrestler, and he has a BMI that's greater than 30. And I can tell you he has no fat on his body. He's very muscular. And so that's, you have to take that you have to interpret that, that number. It's not just a number that you can use for everything, but those are the ranges. There is some disagreement about whether having, being overweight is actually good for your bones or not so good for your bones. So certainly if you become diabetic because you're overweight, that's bad. That's bad for your bones. But of course, bones are structural, and some people would suggest that if you have more weight, that you're putting more weight on your bones, and bones will respond to having greater loads put on them. And so that may actually be a case in which, being a little overweight is not so detrimental and could be beneficial. The other thing is that fat will store estrogen. And so in those women who have low estrogen levels, if they're a bit overweight, they can be storing estrogen in the fat, and that can actually help to slow down the loss of bone as well. It's kind of an interesting. I hope I don't get myself into trouble here, but cut it out if I do. It's sort of an interesting evolutionary adaptation. I've always thought that when women become menopausal, they tend to begin to put on weight. It's very difficult for menopausal or postmenopausal women to keep weight off. And to me, that seems like kind of an evolutionary, or at least an adaptation to preventing bone loss in these women who now have less of an estrogen stimulus because they can store some estrogen in the fat.
Right. Thank you all for watching. I hope that you found the video informative. Please do hit the thumbs up button, subscribe to our channel, and hit the bell button for new video release notifications. It encourages us to continue to create more videos about anti-aging and extending healthy lifespan. Thank you so much for your kind support. I wish you all well and will speak to you again soon.